Doctor, you are a neurophysician and neurosurgeon. Tell us why you chose this area of expertise.
I think it's a very interesting question that why I chose this field of neurology and neurosurgery. Since college, I have been very much interested in the field of neurosciences, and this was magnified when I was studying in the medical school, where I read a lot of books on the mysteries of brain functioning. So once after graduating from the medical school, I had a lot of opportunities. Being in Madras Medical College, where I did my MD General Medicine, I had a lot of opportunities to interact with the then pioneers in neuroscience, like Professor B. Ramamurthy, Professor P. Narendran, Professor S. Kalyan Raman, Professor T. S. Kanaka, and the neurologists, Professor Jagannathan, Professor Arjun Das, Professor Krishnamurthy Srinivas, Zahid Zayed, and a whole lot of others. In fact, I started interacting with them, and my love for neurology and neurosurgery continued to grow exponentially from that point on. Yes, and that's why I chose this expertise.
Doctor, could you just tell us how many years did it took for you to study and achieve this unique qualification?
I think it's a total of 15 years. I first was MBBS for 5 years. Then I took my MD General Medicine for 3 years. I had the aptitude of becoming a physician. Thereafter, I specialized in DM Neurology for 2 years from the Institute of Neurology, University of Madras. And then I took up MCH Neurosurgery for 5 years. Well, I feel in this long journey, one has to have a lot of passion, commitment, determination, patience, tolerance, and perseverance to travel this long journey with ease. Neurology and more so neurosurgery, they demand long hours of work. And this is the journey of mine which I have taken up for neurology and neurosurgery. And thereafter, I went in for continuous update of knowledge is extremely important. You can't just stop studying at any one particular point of time, because you have to constantly keep updating the knowledge. That's very essential. Thank you.
Doctor, could you just tell us about the various reasons for which people seek a neurologist and neurosurgeon opinion directly?
Well, that's indeed another very interesting question. The various reasons for which people seek a neurology or a neurosurgical opinion. The commonest, of course, is headache. Then comes neck pain, back pain, weakness of one half of the body, fits, epilepsy. Then patients with brain tumor. It can be a cancer or it can be an infective lesion. Meningitis, the covering of the brain getting inflamed. Balloon-like dilatations in the blood vessels, aneurysms. Then malformations of the blood vessels, as what we call as the arteriovenous malformations. Disorders of the spine, that I told you, cervical, lumbar disc prolapse. Tumors of the spinal cord. Then cerebrovascular accident or brain attack or stroke. Either it may be a vessel occluding and thereby no blood flow, or a vessel getting ruptured and hemorrhage occurs inside the brain. Parkinson's disease, you have tremor, rigidity, and slow movements. Multiple sclerosis and other autoimmune diseases of the brain. Between the nerve and the muscle, that junction, they call the myasthenia gravis. Alzheimer's disease, progressive dementia occurring. Mental retardation, and a host of conditions, the degenerative diseases. Therefore, the reasons for which a patient seeks a neurology or neurosurgery opinion will be those who are having headache, neck pain, back pain, those having tremor, weakness of one half of the body, epilepsy, brain tumors, meningitis, aneurysm, arteriovenous malformations, disorders of the spine, cervical and lumbar disc prolapse, stroke, Parkinson's disease, multiple sclerosis, myasthenia gravis, Alzheimer's disease, mental retardation, and a host of disorders comes under the umbrella term of the degenerative diseases. That's it.
Doctor, what are the various significant advances that has happened in the field of neuroscience?
I strongly feel the most important advance that took place is in the field of neurodiagnosis, that is CT scan and MRI. That is almost around 35 to 40 years ago. I still remember when I was doing MD general medicine, a CT scan has not come into vogue at that time. And my thesis was for is brain tumors and the detailed clinical and diagnostic aspects. And I remember I used to go sit there, in fact, trying along with assisting an angio, how to be done, and studying the brain lesion if there is, by displacement of vessels and so on indirectly. But with the advent of CT, as I was entering into DM Neurology, the CT scan came into the Institute of Neurology, and then it was a real thrill for us to see the brain and the ventricles and the various structures in the brain and so on. And as I was entering into MCH, I did find MRI coming into vogue. So it's a great thing. So CT and MRI has revolutionized the diagnostic armamentarium of the medical field, more so in the field of neurosciences. And now you have further refinements of these. Earlier, the CT scan, used to take around 15 or 20 minutes for the brain itself. Now, with just 2 minutes from the head to the hip, we can have the CT scan pictures done. And MRI also, there are a lot of advances in MRI now. You have the T1, the T2 weighted image, the diffusion weighted image, MR spectroscopy where you measure the chemicals, and the arterial spin labeling techniques we have. And also, we do have the functional MRI. So, you find a lot of advances are taking place in MRI too. The other advances, there are, apart from this, from the diagnostic tool, you do have various other advances in the field of medicine. To mention a few, the reversal of stroke if a patient is brought within 3 hours. Within 3 hours, if you have a face weakness or an arm weakness or a speech disturbance, and if it's suspected stroke, immediately you're brought into the hospital, investigations can be done, and within 3 hours we can give a thrombolytic drug and the clot can get dissolved. So that is one of the greatest advantage. Otherwise, beyond 3 to 4 hours, what happens is there will be a blood-brain barrier, and it'll get broke off, and then you find there'll be hemorrhage if you try to do a thrombolysis beyond 4 hours. So that is one other advance, reversal of stroke if treated within 3 to 4 hours. The other, there are a lot of newer anti-epileptic drugs that have come to control epilepsy. Then immune modulators for demyelinating diseases. Then for degenerative disorders, we didn't know what exactly is the problem. Now, a lot of them we have identified genetic mutations. And also in the field of neurosurgery, microneurosurgical principles, the neuronavigation, minimally invasive neurosurgery like neuroendoscopy, deep brain stimulation for Parkinson's, then endovascular therapy for aneurysms. Earlier, you had to do craniotomy and clip the aneurysm. Now is a non-invasive procedure. We can treat the aneurysms. Nanoneurosurgical targeted therapy for brain tumors. Frameless stereotactic radiotherapy is there. There is maximum dose given to a small area of the tumor so that the normal brain and others will not be, they will not have any damage. Then in future, of course, for the neurosurgical pre-planning as well as for the neurosurgical education of the patients, we can have mixed reality immersion techniques. That is in vogue in another about a year or two. It's going to come and it's going to be the order of the day, where the whole aspect of the training as well as even doing what you can say surgery, where you can see the lesion in a mixed reality in a real environment, as well as with the 1 foot in the real environment, 1 foot in the imaginary thing, with of course the 3D effects of both the CT, MRI and the anatomy superimposed. You can actually manipulate and see where the lesion is and plan accordingly and do the surgery. So that is going to come very, very, very soon. These are some of the advances. There are very many in the field of research also. That's it.
Doctor, what about your contribution to research work?
My contributions, some of my contributions to the research work in the field of neurosciences are these. The intracranial tumors, I did a detailed study of 25 cases. That was in the month of May 1979 to March 1981 on the clinical aspects as well as the diagnostic aspects and a glimpse into the treatment modalities. The other important work which I done was along with the Madras Paraplegia project, that is on spinal injuries. It was a detailed study on the various clinical patterns, the prognosis and what are the treatments that have been rendered. And this was presented in the International Paraplegia Conference at Perth, Western Australia, where they have one of the world's largest paraplegia center. That was a study from October 1986 to October 1987. Further, I have done extensive research on one other condition, that's the brain tumors in tuberous sclerosis. It's a condition where you have adenoma sebaceum as well as mental retardation and epilepsy. It's a combination, but it of course now we know that all organs can get affected. And apart from it, the lesions inside the brain, the hematomas or ones that is occluding near the foramen of Monro, and as a brain tumors in tuberous sclerosis, it was an extensive research that was done from October 1985 to October 1980, and the results of which were presented at the World Congress of Neurosurgery in Delhi. The other area where we have done research, or I have done, is the brain tuberculomas. It is very difficult, in fact, to diagnose brain tuberculoma dogmatically, other than we do a biopsy, because these occurs in very young patients and they are hale and healthy and they do not have much of deficit excepting a fits. So the controversies in the diagnosis and management, this was a study done from 1992 to 1998, and this was presented in the first Asian Congress of Neurosurgery in Nagoya. The other research work which I have done is the composite care of brain trauma, an analysis of around 3,500 cases from January 1997 to July 1997, which had been seen when I was working in the Institute of Neurology, and where we have is a large referral center where there is a lot of cases, rather about 30 to 40 head injury cases occurs a day. And this was in fact presented, the results of which were presented at the second Asian Congress of Neurosurgery in Nagoya. And one other subject, my field of interest is gliomas and low-grade gliomas. There are a lot of, in the management modalities, there are a lot of controversies. So these were put up, and I had presented low-grade gliomas management modalities from 2001-2002, and this was presented in the third Asian Congress of Neurosurgery in Hong Kong. Besides, a clinical trial has been done, the role of memantine in improving the cognitive functions in Parkinson's disease. We did find a marginal improvement has occurred with this particular drug. So this is one of the study have done. And then there are certain publications also where I have done for books also. Yes, that's it.
Doctor, could you just tell us what is this awe and mystery of brain?
I can tell you there's a lot of awe, when you are actually seeing the brain. Having scanned and worked with more than now nearly 40,000 brains, it is dear to me that brain is involved in everything what we do. When your brain works normally, you are a normal person. When your brain has trouble, you have trouble in your life. Brain dysfunction is the number one reason why people fail at school, at work, and in relationships. Brain health is essential to all aspects of the quality of life. Indeed, your brain is the command and control center that runs your life. For example, when I'm sitting like this, I'm able to observe the color around. I'm able to observe and interact and understand the meaning, all occurring in a fraction of a second. The brain is working actually from the anterior to posterior, the right to left, superior to inferior, round the clock. And it is shown in the BBC once, there was a SPECT study done, and they found when a person is just sitting and observing his surroundings around himself, all parts of the brain were flickering. That means the brain is a wonderful organ that is bestowed on us by God. That's the Ahvan mystery of the brain. And what we have studied is almost around only 30 to 40% or 50% of what the brain's functions are. We know the functions when you find a deficit occurs, when a lesion occurs, when a destruction occurs of one part of the brain, then we know what exactly is the function of that brain. That's it.